morning. I'm John Lentz, the editorial director at City and State. I'll be moderating today's discussion, which centers on the Fair Pay for Home Care legislation. This program is sponsored by AARP New York. Advocates have been pushing Albany lawmakers to set an adequate wage level for home care workers, which in turn would strengthen and support a workforce that has a critical role, allowing the older population and the disabled to stay in their homes.
Yeah, turn it up. John Lentz just talking.
As opposed to nursing homes and assisted living facilities. We'll talk about what got done last year, how changes have been implemented, what's on the table this year, and the chances of various proposals being included in the state budget or otherwise this session. We may have time to hit on a few related issues as well, and we'll try to take a few audience questions as time permits. And you can submit those in the questions tab. We may not see any questions that come through the chat. So again, if you're out there in the audience and you have some questions you want to get through to the panelists, select that questions tab and we'll see if we can have time to get to a few of those. Before I introduce the panel and get the discussion going, let's hear from James O'Neill, the state president of AARP New York, who will offer brief opening remarks. James, over to you.
Good morning. Thank you, John. Thanks to City and State for hosting this webinar, and thanks to all of you for participating. Home care is the future. New York State's population is aging fast, and the gap is only going to widen in coming years. More and more older New Yorkers will need long-term care. Both from a compassionate and cost-effective standpoint, the state should strive to ensure that as much long-term care as possible is delivered through home care. Most older New Yorkers want to receive care in their homes, with and near their own families. And home care is far less expensive than having a place to place our loved ones in mostly taxpayer-funded nursing homes. Family caregivers rely on home care workers to take some of the burden of providing care to our older loved ones at home. And of course, to handle tasks that family members cannot. Yet, as the number of older New Yorkers grows, the number of potential family caregivers is shrinking. To compound matters, we have an unstable, unpredictable home care system in New York, making home care too often unavailable. We need to stabilize our home care system. That starts with giving home care workers fair pay. It's both the right thing to do and the sensible thing to do. A lack of investment now will cost us all dearly later. You can join us in asking your state legislators to address fair pay for home care in the budget that's due April 1st by going to this easy to remember address. Ready? action.aarp.org/New York budget. That's action.aarp.org/NYBUDGET. Again, thank you for this important forum, and we look forward to its important conversations and hopefully important action this season. Thank you.
Great, thank you, James. We'll now bring up our panelists. If you're on the panel, go and turn on your videos, unmute yourselves. We'll get started momentarily here. I'd like to introduce our panelists today. We have State Senator Gustavo Rivera, who is the chair of the Health Committee. We have Assemblymember Amy Pollon, who is the chair of the Assembly Health Committee and who's new to that role this year. Joining us shortly, if she's not already on, oh, there we have her, State Senator Rachel May as well, who's the chair of the Aging Committee, playing a key role on the issues we'll be discussing today, as well as Audria Powell, President and CEO of Cooperative Home Care Associates, Alana Berger, New York Director of Hand in Hand, and finally, David McNally, Director of Government Affairs and Advocacy for AARP New York. Thank you all for joining us today. Now, as you know, state legislation was passed last year that increased the pay for the state's roughly 100,000 home care workers by $3 an hour and phased in over 2 years, I believe, with an additional $2 an hour this year and $1 an hour in the coming year. And not only that, it was indexed to further minimum wage increases, and I believe this was funded with $7.7 billion from the state. So how well is that working out? And Senator May, again, you've been the forefront of this issue. Let's start with you, and welcome.
Well, first of all, thank you. And thanks for foregrounding this issue, which is just so critical to the workers, to the people who need the home care, to the families of people who need home care, and to our state in general, to the whole state economy. In terms of how home care is working out, so we did raise the minimum wage and it went up by $2 on October 1st and will go up another $1 next October 1st. And I did see a question about why is that money not getting to the workers. That money is getting to the workers. That's why we made it a new minimum wage. It's the law that they have to be paid that amount. The problem is that the money isn't flowing to the providers who hire the workers. And so they are having some trouble both being able to afford to hire enough workers or to pay them whatever benefits they were giving them before. In some cases, they're having to cut back on those benefits because the insurance companies that the money went to are not acting in good faith necessarily when they're making the contract. So that's one of the things that we're trying to follow here, is really make sure that the money flows as it should to the people who hire the workers so that they can then pay them the amount that they deserve and continue supporting them in other ways too.
Sure. Thank you, Senator. A quick follow-up on that. At the time this past last year, you tweeted, quote, "New York is making the largest investment in home care wages of any state, maybe ever." And yet this was something of a compromise. Am I correct that some of the advocates out there wanted significantly more? Could you walk through that and I guess what's on the table this year?
Sure. So fair pay for home care, the ask is 150% of minimum wage for home care workers, which $3 doesn't come close to 150% of minimum wage. But it's also the case that every dollar that you raise the wages for home care workers is about a $800 million ask in the state budget. So that's a lot. And, you know, there are always trade-offs in the budget. So we got, the majority leader was all in working to negotiate this, but $3 was all she was able to get.
Got it. And we'll discuss a few of those items further, including, you know, is the money actually getting to the workers? Any concerns about the insurance companies, as well as legislation this year. But I did want to turn to Senator Rivera. I believe this legislation comes through the Health Committee. How would you say, again, the legislation passed last year, how is that working out? Senator
Well, first,
Rivera.
I'm a little stuffy from allergies, so I'll apologize ahead of time. And I also want to take a step back to reframe the conversation and underline something that was said a little bit earlier. The reason why this is so essential that we get this right is because not only are people that are home care workers going to be, if they get paid more, then they have better lives, their families have better lives, but also the kind of care that they provide means, as was said earlier by Mr. McNally, that folks won't actually end up in the nursing homes, which actually are more costly, and certainly people were better off remaining in their communities. So and I also want to underline that a lot of these things, I certainly want to make sure that when we talk about them as investments, like the conversations that we're having right now about how we take safety net institutions and give, like the conversation that we're having about Medicaid rates being higher, are about investments in stabilizing institutions, and in this case, it is investments in stabilizing the lives of people who are home care workers, who in turn help stabilize the lives of the people who they serve, their patients, right? So is it working well? Unfortunately, not so much. The money is not flowing to workers the way that it should happen. And we had discussions during the hearings. There was a budget hearing that we had just a few days ago. And we asked the question of the administration, who insists that the current way of doing this whole thing, that managed long-term care plans, are the way to actually continue to do this. I have some serious concerns about that, and I want to make sure that we ask the questions, because I don't think that it's working appropriately. The money is not flowing to the workers. At least that's what we heard both from providers as well as workers themselves. And I'm glad that the battle has been fought, but we need to fight a little bit harder and ask better questions to make sure that the workers actually get the benefits that they deserve here.
John, can I just step in about the investment issue? So when we made the ask for 150% of minimum wage, that was premised on research that showed if you make that investment, the payoff is about twice as much, because that does bring more workers into the field, which enables more people to stay out of nursing homes. It also pays people a living wage, so they are able to stay off of public assistance. A lot of people who are doing this work are also on public assistance because they can't make enough to live on. So it also plows a lot of money back into communities, because when people stay in their homes, they're also spending money in their local economies. And so the payoff was about twice what the investment was. When you nickel and dime it, the payoff is a lot less, because you draw fewer people into the field, and it doesn't have as much of an impact in keeping people out of nursing homes, for example.
Good. Thank you, Senator. Let's turn to Assemblymember Amy Paulin, and anything you want to add, but also I'll just read a note from someone in the audience who says, the Fair Pay for Home Care Act would address all of these issues. It was included in both the Senate and Assembly. One House this last year. There's a push again afoot. So I think most of us on this call know, sponsored by Senator May and Assemblymember Paulin, according to this member of the audience. Senator, let's go over to you.
So, my colleagues, thank you. You've articulated it very well. We not only have a problem in that the money isn't flowing properly, we also don't see an increase or the problem being alleviated in terms of the workforce shortage. That was a critical component of why we needed the extra money. We heard at the hearing, as Senator Gustavo said, sorry, I called you by your first name. He pointed out that, we heard that, we heard a lot of complaints. We heard that people could more easily work at Walmart, more easily work at McDonald's. They were going to make more money. And and that's still a problem, and if we, and the current budget, phases out this increase, it eliminates the increase going forward, and, we can't survive that way if we want to rely on home care. As someone who I took care of my mom in her last days, and we relied on home care. We wanted to keep her at home, and it was erratic. You really couldn't get, there was just a shortage, and we couldn't always get the kind of care we needed. So I'm very sensitive to the shortage problem. And if we don't increase wages, and we don't allow the money to flow, providers are going to go out of business, and we're just going to increase the shortage. We're not going to alleviate the problem. So we have to fix this. We have to monitor the plans. We have to make sure the money flows. We have to long-term make sure that home care workers are valued, and the monies are greater, than what they could get in other types of jobs. This is an important job. It's taking care of our loved ones. We have to show that in our healthcare system.
Thank you, Senator. Before we go to the two other advocates we have on the panel, or three rather, just want to ask the state lawmakers quickly, the legislation that's on the table this year, is that likely to pass in any form? Is it likely to be included in the one house budget bills that are going to be coming out? Senator May, let's start with you.
So that's actually a question for Gustavo, but I believe the Health Committee is recommending that it go in the one house, which is really important. That's the first step to getting it, you know. If it's not there, it's definitely not going to go in the budget.
Yeah. Senator Rivera.
Want to make some news, John? Is that what you're trying to do? I will tell you that we're in the process. We're in the process right now of having the discussion within the conference, the working group that I lead, the health working group, which includes aging, and obviously includes consideration of this bill. We did have the discussion within the working group. We're making a recommendation to the conference and to the leadership, and we will know just shortly whether it makes it to the end. But as we've talked about before, right, this is about a balance of a whole host of things: education, transportation, et cetera, et cetera, et cetera. So it's under consideration. We'll see whether it makes it to the final bill.
Got it. And in the assembly, is Senator Paulin, any?
We're in the same position, same position, where, obviously there's a strong commitment in our conference and by the speaker, to increase wages, but it is a balance. There's a lot of needs, and we'll find out next week.
Got it. Let's turn to Audria Powell with Cooperative Home Care Associates. Again, where do you see the lay of the land right now on this issue?
So thank you for having me this morning. I'm really happy to be here with this entire panel. As a home care provider, Cooperative Home Care Associates delivers licensed home care agency services and fiscal intermediary services to New York's older adults and New Yorkers living with disabilities. And it is really essential that we increase the workforce pay through fair pay for home care. And I think I have to underscore how important it is to actually bring in and pass fair pay for home care, because what it does is actually tie the increase of wages to adequate reimbursement rates. And we are going to be able to get to a real understanding of what it costs to deliver an hour of services in New York State. The problem right now is that we have a mandated wage increase without adequate reimbursement. So providers like CHCA and many others are paying out the $2 increase and soon to be another $1 increase in October, and having to fight tooth and nail to actually get the reimbursement rates to cover that. So we increased rates October 1st to $2. That costs Cooperative Home Care $2.66 to actually implement. And on average, plans were paying $1.85 for those increases. Some as low as 20 cents was being offered. Some as low as 50 cents was being offered. It was extraordinarily challenging to even get any rates. And the Department of Health believes that plans are actually negotiating in good faith. There are not a lot of plans that were negotiating in good faith. In many instances, we were told to take a rate, and that was it. There was no discussion. We knew that this was going to be the situation. And had we included the language that was in fair pay for home care, we would not be in this situation. And going forward, any continued increases will continue to go down this road if we don't have the right mechanism for payment. And that mechanism does reside within fair pay for home care.
But a couple quick follow-ups for you, Audria. One, is it the Department of Health that would be enforcing this, that could or should take action to ensure that providers are getting paid adequately to cover those wage increases? And then on the legislation, what exactly would be included in there that would rectify the issue?
So the Department of Health could establish benchmark rates. The Department of Health could enforce a directed payment. That's done in other instances. And there has been some talk that it can't be a directed payment because so much of the spend is just for personal care services. So essentially managing only one service. which begs the question of what Senator Rivera raised. If this is not the format for delivering these services, then perhaps we should be moving away from the MLTC structure for this. A significant amount of administrative money stays with the plans for personal care services, when in fact, as a provider of home care, we are the ones who are ensuring that that home care worker gets into the home and is staying in that home. And we're the ones responsible for training the home care workers, providing the wages, providing the benefits. There is a minimal amount of direct contact that plans are doing for these home care workers to be in the homes. That's on the providers. And so having, perhaps the issue is we need to revisit the structure of the MLTCs and whether this is the way that we should be delivering personal care services.
Got it. And I think we'll get back to that momentarily. I do want to give a chance to Alana Berger with Hand in Hand to speak. Over to you.
Yeah, hi. Thank you for having me here too. And just to note, I'm with Hand in Hand and also the co-director of the New York Caring Majority Coalition that's really been pushing and partnering with our advocates in the legislature. I mean, I think I could sort of just sum up a little bit. I do want to add to sort of what Audrey was saying or underscore with these insurance companies that we just were able to access some financials that show that, again, that these private insurance companies have profited in 2021, which is the last full fiscal year we could get numbers for, $750 million. That's profit. That's our taxpayer dollars meant to get, as Audrey said, to providers, to folks on the ground to actually do home care. And these plans made $750 million just in straight profit. That is also, interestingly, about the same amount of money that it would cost to implement fair pay for home care. So direct correlation between literally our taxpayer dollars designed for care being siphoned out of the system into the pockets of private insurance companies that could be in the pockets of workers. And I think all of this, what's so, going back a little bit to the context that Senator Rivera laid out, this is such a universal need across New York. You heard Assemblymember Pollen has her own story. Everybody in New York has their own care story, whether it's receiving or giving care. Governor Hochul has a care story, which she shared with us in a meeting last year. And that is why, home care is skilled healthcare work. It's bathing, it's toileting, it's meal prep, it's tube feeding, wound care, and it's also just being people's companion who are alone. It is essential work, and it gives all of us the choice to age where we want to age, which you can look at lots of polls that show that 90+% of us don't want to be in a nursing home. I think that's also common sense, and it is a job that deserves pay commensurate with the skills. We in last year's budget really, I think, gave a gift to Governor Hochul. We had bipartisan support in both chambers of the legislature. We had from the North Country to Long Island to Buffalo, Rochester, Hudson Valley, New York City, across every geographic region of the state. We had we had a really sort of bizarre coalition where you had home care agencies, employers and workers and the union and the NAACP. We had everybody. And not only that, we had something that was popular for basically every New Yorker. And it showed that it was an investment that actually brought money back into the state. The home care workforce is 90% women, 81% people of color. It was going to lift up a low wage workforce. So we had everything. So it's very confusing that the governor, and whose master plan on aging calls for creating an infrastructure in New York State that would, allow all of us to live and age in our own homes if we choose. It's confusing that she chose to not go with the full legislation that would both get the money to workers, keep people in their homes, and make sure that the money actually did not end up in private insurance company pockets. So when we got what we got last year, and she said it herself in the gubernatorial debate, it was a first step. So to see her go back on that in this budget and freeze the $3 indexing that we did win, so that home care will again become a minimum wage job as the minimum wage catches up, is, again, it's very confusing. And so we will continue to sort of organize and make the case that this is a win-win for New York. So yeah, that's what I have to say.
And a quick follow-up for you, and then we'll go to David McNally, AARP. In response to some of these points, I believe the governor's office had this statement, quote, Governor Hochul believes that all New Yorkers deserve to be paid fairly, including home healthcare workers. And there's nothing in our budget that would reduce wages for home healthcare workers. The governor's executive budget proposes raising the state's minimum wage by the growth in the year-over-year consumer price index for wage earners. And in fact, the governor secured $7.7 billion to increase wages for those workers over the next 4 years, which is something that won't be impacted whatsoever by the minimum wage proposal. Alana, I think you were hitting on some of these issues. If you could respond to that.
I mean, my response is that, yes, it is true that home care workers will be, as of this October, $3 above the minimum wage. That is about the only thing in that statement that is true. Given, we are not, this is not the folks working specifically on the minimum wage, although we support a minimum wage increase for all workers. We believe all workers deserve dignity and are not trying to get into a back and forth about who deserves more, whether you're at McDonald's or in home care. All workers deserve an increase in the minimum wage. But what the governor's budget does, you can look at, it's right in the labor language, it freezes home care at $18 an hour. So for workers in all of downstate, that is October 1st of this year, home care. So the indexing, meaning that home care is always $3 above minimum wage, will essentially end the moment the minimum wage goes up. So, and we can share a nice chart with you that we have, but every time the minimum wage increases, the differential between home care and the minimum wage shrinks. And again, when you have to recruit hundreds of thousands of workers into this workforce, that completely diminishes the competitive advantage and is just going to add to the worker shortage until the minimum wage hits 18. And then, as was said in budget hearings, well, then maybe we can have that discussion. So it is just false that, and again, confusing that less than 8 months after the governor acknowledged home care does need to be indexed to minimum wage because we need to recruit people to this workforce, she's already gone back on it.
Got it. Now, Senator May has to leave for another obligation shortly. Any final thoughts on anything that's been raised so far here, Senator May, before you go?
Well, I am so grateful for the advocacy of AARP, for Hand in Hand and the Caring Majority and 1199 who have worked so hard on this issue. And we're going to keep working on it. I mean, for everything Alana just said is absolutely true. And the people in this state who are leaving the workforce because they have to stay home with a loved one at a moment when we need more people on the job in New York State is, hurting our economy. And the people who are being forced into nursing homes, and we hear horror stories about what nursing homes are like, but we're also paying huge amounts of money, both as taxpayers, and they are paying a lot out of their pockets too. All of those stories, there's millions of stories of ways that this will make life better for individuals, for families, for communities. We just have to keep pushing on this. And I'm really grateful to my legislative colleagues for the work that you're doing and to everybody who's pushing for this. So thank you.
Great. Thank you, Senator May, and thank you for joining. We'll go down to David McNally with AARP New York.
Thanks, John. We just did a release of a study from the Center for Urban Future that said in New York, there are now more people over 65 than under 15. We know that from a survey we did last year of the 50 plus in New York, almost 90% want to receive care in the home if they need it. How many want to look forward to going to a nursing home? 2%. I mean, all the demographic information is there. This is what people want. And in order to get it, we need to, as the senator said, invest in the present and invest in the future. And this is not an idea that is a long way away that we need to address. We need to address it here and now. And there are waiting lists for home and community-based services. And those waiting lists are driven by two things. One is the lack of funding that goes to the area agencies on aging to provide those services of the non-Medicaid population. But a new wrinkle in all this is some of the area agencies on aging have the money to provide the service, but can't find anyone to actually pay to go do the service because there is so little home care reason to take this on as a profession. And it is the most critical. What is more important than taking care of our most vulnerable people in New York State? I can't imagine what it is. And they should be compensated accordingly. And at ARP, obviously a lot of our members are the recipients of the care, but we look at this from a family caregiving landscape as well. Family caregivers, the unpaid family caregivers, rely on the paid home care worker to provide a little less burden for themselves and also to do the work that they cannot do themselves. So we're in this about everybody. It's about the person receiving the care. It's about the unpaid family caregiver struggling to keep their loved one at home. And it's about the paid home care worker that is such a necessary part of keeping people in their homes safe, healthy, happier, and at a much can be at a much less cost than institutional care that frankly nobody wants to be in unless they absolutely have to be.
Great, thank you, David. Let's turn to the price tag here. Again, we heard from the lawmakers, this is one of multiple funding priorities. There is only so much money in the state budget. I mean, it is a major state budget, very large, but this particular legislation, Fair Pay for Home Care, what is the price tag? What would that cost? What is that in the context of the overall budget? Could anyone go through some of those details? Again, and I believe, again, the Hochul administration said, look, we added $7.7 billion already. Are we looking for, 10 billion, 20 billion? Like what's kind of the ballpark on what this would cost taxpayers to implement at the level that the advocates want?
I'll make 2 points. I don't have the number in front of me right now, but I'm sure that some of the folks that are particularly, probably Alana probably has an idea of the cost here. But let's think two things. Number one, that this is about, as we stated many, many times during this conversation, this is an investment. It's not about expenditures, it's about an investment. It's going to cost us more later if we do not make, that's what investments are about, right? Making sure that we don't have to spend more later. And anything and every dollar, there's probably a stat here about every dollar that we spend on home care and stabilizing the lives of the people that don't go to nursing homes save us, a particular amount of money. I'm sure the stats are there. But the second quick point that I'll make before I pass it to folks who probably know the number, there is the revenue if we actually tax the wealthy. Invest in our New York. There's a bunch of bills that that are under consideration, whether it's capital gains tax, making the corporate tax permanent, et cetera, et cetera. The revenue is there in the pockets of millionaires and billionaires. We need to make sure that we go get that so that we can then invest in things like home care that will actually make our state better, not keeping the money in the pockets of millionaires and billionaires.
Thank you, Senator.
I can jump in and say, so first, we have already put some of the money in by doing the $3 increase. In order to go to the full implementation of fair pay for minimum wage, fair pay for home care, which would be 150% of the minimum wage. We're talking about $1.8 billion. Current annual funding for home care would be raised I'm sorry, it would cost an additional 800 million state share to go to the 2250.
Got it.
And I would just lift up, sorry, Laura's question. There's in the chat, the other side of this is what would it cost to not fund this? And, we're looking at hospitals that can't discharge people because they can't find home care. We're looking at more of people forced into institutions, into emergency rooms. The cost, both human cost and, actual cost is much greater if we don't make this investment. And again, just want to underscore that it's fascinating that the amount that Audrey just said, about 800 million state share, is very equal to what the managed care plans are taking away in profit. So we have the money right there. We should definitely be raising taxes on the wealthy. And even if we didn't, the money is there in this system and it's being sucked out of the system.
I often think if health, safety, quality of life, and economics of keeping people out of nursing homes doesn't move you to act on this issue, then budgeteers who are always talking about economic development and tax breaks should look at this through the lens of what the economic development impact of funding livable wages for home care workers means. It means the person receiving the care stays in their home, pays their taxes, buys their groceries, it's contributing to the local economy. The person that's being paid to provide that service, again, they're not sending their money off to dividends, right? Those home care workers are paying in their local economies for gas and food and all those pieces. This is a tremendous contributor to local and state economies, not just saving the state money through keeping people off Medicaid when they can be, and also keeping people out of Medicaid funded nursing homes as long as possible, but the economic activity generated by this is tremendous. And I urge people that don't want to look at this any other way than dollars and cents to consider that.
I'm just going to chime in here a little bit. I think that, we also have to think about the humanity of how we want to live and how we want to take care of our loved ones. And, when you're in that circumstance and you want to keep that loved one with you at home, this is the only option you have. And, it's very important that we think about it from that lens because, it is one of the highest growing costs of Medicaid. It is. We can't get around that. But then you have to counter that with, with the humanity. And I think if you do that, then you come out wanting to improve this service and wanting to attract quality workers and workers, period. And the only way to do that is to raise the salaries.
Got it. Okay, given all that, and I read one quote from the Hochul administration. It seems like, hey, we did what we did last year, and let's move on. Seems to be their message. What is the likelihood this legislation in full would pass this year, or getting closer to it? Is there any signs or indications from the Hochul administration about what they might support or not, or just who knows?
At this point, the best indication of how hard we're going to have to fight this battle and other ones will be the 30-day amendments that come out tomorrow. So we'll have to. I will wait for those, and then kind of give you a sense, because we've certainly been having conversations both during the hearings and privately about a whole host of issues, including this one. So when the 30-day amendments come out tomorrow, then we'll have a better idea of where we're standing, and will certainly give us an idea of the battles that we have to fight in the next couple of weeks for the budget and the next couple of months for the rest of the session.
And if I could, we heard our elected officials who are great champions for this talk about, there's needs all over the budget, which absolutely. But in a $227 billion budget proposal, you got to make priorities. And I just can't imagine anyone thinking that this is not a priority of taking care of our most vulnerable loved ones, keeping them at home, paying a good wage to those that we are entrusting in this sacred work. And the humanity, as the Assemblywoman said, what's more important in a budget than this? So I hope that's on the top of mind of all of the people that are involved in negotiations in the budget. And I too am, I'm not hopeful, but I'm interested to see the 30-day amendments and see where we go from there.
Certainly.
And I think it comes back to, Alana raising this point about it's all very confusing. All of the statistics point to our population is aging. We have 62 counties in New York. 51 of them by 2030 will have 25% of the population over age 60. And 18% of the counties will have 30% of people over age 60 by that point. We know we're in a crisis right now with the workforce. We know people are going to need these services even more. And the services and the care that home care workers deliver is a skilled quality service. They are there ensuring that people can get up, can eat, can live, can take medication, can be fed by tube feedings if that is what happens, if that's what's necessary in the consumer directed program, helping to manage medications. And all of this will help reduce hospitalizations, nursing home, and going into nursing homes, all of which are much more costly. Right now, we've got the wait list. Somebody who can't get these services that they need to continue to stay independent and healthy in their, or stay stable in their homes, they're going to end up in an emergency room. They're going to end up in a nursing home. And when the nursing homes and the hospitals want to be able to discharge, they can't, because we don't have the workforce out there. And it's because we won't make the investment in this workforce.
Got it. Let's return to an issue that was raised earlier and getting in the weeds a little bit here. MLTC, the Managed Long-Term Care Plans. I assume a lot of people tuning in understand some of that, but if one of you could just kind of explain its role here, what an alternative might be. Is there any legislation in the works or introduced that might restructure how this money goes out in a way that is more fair and as intended?
I'll say, well, I know that David has just muted himself, but I'll say quickly that the first thing is that one of the things that I asked about in the hearing the other day is there is a report which was due last October that was supposed to kind of really dig deep into whether this is a system that actually that actually serves us well. We still really haven't seen. There was supposed to be a preliminary report. I don't remember seeing that even. I asked them during the hearing when we were going to get it, and that's kind of, whether it was this administration or the last one, they have this thing about reports that never make it, even regardless of whether they're written or not. But I think that there's really some serious questions that have to be asked about whether this is the best way to deliver care to this particular population. I have my serious doubts.
Mm-hmm. Mm-hmm. Adria or Alana, could either of you sort of explain the MLTC issue and any thoughts on how you would like to see that changed?
You want to do it? Yeah, you go. Audrey, you start. I'll chime in if there's anything else.
I mean, sort of very simply, I don't want to see $722 million going out to the plans when, in fact, it is providers who are working to recruit, retain, and place the home care workers in the field and doing the support. We are the infrastructure that works hand in hand with the workforce to deliver the services. Sorry about that. It's not coming from the MLTC. So it feels really challenging to have such a large amount of money going into the plans when that could be going to home care workers and the providers who are delivering the services.
And is there any reason that money couldn't be directed directly to providers?
So the current model is definitely not the only option or what has to be. In fact, it was only enacted with the first Medicaid redesign team under Governor Cuomo. So it has not been that way always. Other states have moved away from the managed care model. And so there are many proposals out there that would save, again, probably billions of dollars by very minimal. This is not the model that needs to happen. And many models would get the vast majority of our dollars right to the home care providers and then be able to pay the workers.
I think
it's a great question to ask the governor why they're using this model, continuing to not explore other options. Sorry, that's not the number.
Yeah, no, I was just going to say, we see even in this budget and the proposal last year that there's a desire on the part of the administration and DOH to change at least the number of managed long-term care providers. You know, they recognize that some of them shouldn't be in this business and that there's too many providers to hold accountable. And some of them might be bad actors. So they're looking for consolidation. And, you know, in that process, I think there's an opportunity to reevaluate how we do give care. But it's certainly being recognized at this point by the administration that there has to be some change and accountability in this system, especially now that we've seen how the money has flowed or not flowed, needs to be recognized. It's frankly illegal for the plans to hold on to that money, but if nobody is looking at it or holding them accountable, how are we going to figure that out? You know, so one of the things we have in the bill that we put forward this year is to have the controller be able to audit and to, you know, so that we get at some of that accountability, because if DOH isn't going to hold them accountable, somebody has to. And we really need to know who are the bad actors. I mean, whether or not we should completely restructure MLTCs. I'm so new. I'm listening and learning. But I do know that, you know, there's an opportunity with all of us to relook, and because the administration is already doing a little piece of that.
And I do just want to add, there is the sort of overall system, but to be clear again, the language, if the language of fair pay for home care were put into the final budget, we at least would not have this problem with the money not getting down to providers. So there's a sort of two-step thing. There's right now in this budget, we must fix the challenges with the payment because providers some are considering shutting doors or cutting other services because they cannot pay the workers the raises they are now entitled to by law and keep their businesses open. So we have to fix that in this budget. And then there's an additional question of, does this system work at all? Like, do we need to actually change the system entirely so that we keep our taxpayer dollars designed for care going to the people who provide care instead of private insurance companies?
Got it. I wanted to take an audience question here. Recent stories in the news about former county-owned nursing homes that have neglected their duties while reaping profits. Home care is better. Can this be used to leverage for this bill?
Well, it certainly, you know, unfortunately, these stories are not new, right? There have been many stories over the years, and it's the reason why we passed some of the bills that we passed in the last couple of years related to keeping nursing homes accountable. And I know that there's still a couple more that we're trying to get on the pipeline. It certainly, since as we've talked about before, every dollar that we invest in home care actually makes it so that people are less likely to go to nursing homes. So I would say that certainly it gives us an opportunity to do just that, to push for it by saying this is just another reason why we should make sure that our dollars go here and not there.
Mm-hmm.
Yeah, I would say that, you know, there's many different types, too many initials for me to know at this early stage in my being the health chair, that take care of our older population, you know, nursing homes, ADLs, et cetera, assisted living, you know, so there's bad actors in all of these arenas. And I don't know that it's limited necessarily to the county nursing homes. I haven't heard that, you know, I don't think there are that many left. One that I'm familiar with has a good reputation, but I'm sure, you know, that you're right. Maybe there's a bunch that don't, but you know, there's a lot of ways to take care of our most vulnerable older population. And I haven't, I think we have to give families a lot of options because they need those options. So I don't know that you want to rob Peter to pay Paul. You know, I think we just have to recognize we have an aging population. We have to take care of them. We have to do it properly, and we have to look at all options available to us.
I'd be committing advocacy malpractice if I didn't. I know this is about fair pay, but given the question, this seems like a softball for me. Just bring up the long-term care ombudsman program just for 30 seconds. The long-term care ombudsman program is woefully underfunded. It is the eyes and ears of the people in those homes. They should be there are 1,400 facilities around the state. They should be making weekly visits to those facilities. The last period we know of reporting on was 3 months last year, and over half of the facilities in New York got no visits. Not one a week, no visits for half the facilities in New York. This needs to be fixed ASAP, and it can be done so by $15 million would allow them to hire and professionalize, to work with the existing volunteers at LitCop to make sure that we are getting into every facility once a week. $15 million is the key. That's what we're asking for. And we think the LitCop being an important part. They're not part of DOH. They are independent from DOH. They are there to be the eyes and ears to help resolve conflict and let people know of their rights and help them resolve problems. So that's my 30 seconds on LitCop. We need $15 million to fix that problem and address this issue in nursing homes.
Great. Thank you, David. I've seen a few comments in the chat about the governor's master plan on aging. Let's turn to that quickly. Kind of a broader issue. The governor's obviously touted this plan. ARP, I think, has designated New York as an age-friendly state. Does her executive budget line up with what she's called for, planned for in that plan? How does that tie in with home care as well?
I could say one quick thing on that, and I note that Becky Prevey, who's one of the people sort of watching, and who's the executive director of the New York Association on Aging, which is the association of all of the offices on aging around the state, has noted that, in addition to sort of all the shenanigans with the Medicaid funded home care, the governor also did not put any money in the aging budget last year to increase funding. So the home care provided through the county offices on aging, they've all been scrambling because they haven't had the funding to fund the raise, which has resulted in about $70 million for institutional care instead of home care. But there are folks who are actually on the master plan on aging. I can see comments here. There's no representation from the consumer directed side. But at the end of the day, what is ironic about the master plan is that there's a whole thing in the mission about allowing people to age in place and age where they choose. But the budget that the governor is presenting is dismantling the systems that are required to do that. And there are actually folks who are appointed by the governor on the master plan who have sent letters saying just that. How can you create this whole image of an age-friendly state when you are defunding and dismantling the infrastructure that we need to allow older adults and disabled New Yorkers to remain in their own homes, and that pay and respect the workers who do this incredibly challenging work enough to be able to stay in it.
Any other thoughts on the governor's master plan on aging?
I've been around here long enough to know that whatever you want to call it a work group, you want to call it a master plan, you want to call it anything like that. I'll wait until the actual legislation language comes up, the budget language comes up, because just what Ilana just pointed out, right? There's a master plan, and yet you kind of see the actual budget, the thing that we're actually going to be asked to vote on. And that kind of goes against what see, is what I'm pomp and circumstance, dog and pony shows are great for dog or ponies. I'm neither. So I will wait to see what it actually says on a budget document, a bill, et cetera, et cetera.
Got it.
James, who gave our state president, ARP state president, who gave the opening remarks, is actually on the master plan for aging. I'm sitting on some sort of work group that hasn't met yet about caregiving. I would say that, this budget doesn't really reflect the rhetoric that we see on the master plan on aging, and that will hopefully that whatever does come from the master plan of aging, follow the money, right? I mean, rhetoric is great, but you got to follow the money. If we need to put our money where our rhetoric is. And I'm not seeing a lot of that this year there are some things you can point to, there always are, but there's a lot of pieces that are missing here this year. Fair pay is at the top of the list. ending the waiting list for more money for those, for the AAAs. There's all sorts of pieces that, tax credits to help people modify their homes so they can stay there. I mean, there's a wealth of ideas that could be done right now. And I'm hopeful that the master plan on aging, with all those people that are on it, that produces something that we can all get behind and operationalize, but it will all come down to the money, right? I mean, there's all sorts of great ideas, but there's very few things in this world these days that cost nothing. And that, with more people over 65 than under 15 in this state, the time is long past that we pony up the money that's necessary so people can age in place with dignity, and the people that provide those services can have a livable wage and make it a career to take care of our most vulnerable loved ones. So we're hopeful that the master plan on aging creates a better tomorrow, but from this year's budget, it's a question mark for me.
Got it. We have just under 4 minutes left. I'll get everyone maybe 30 seconds to a minute for any final thoughts, any point you wanted to make before we ran out of time. Senator Rivera, let's go with you.
Well, I yap more than most folks, so I'll make it really brief. For me, this always comes back to investment. The reason why we fight these fights and we fight these struggles is because putting this money in here makes people healthier, makes sure that people stay in their community, stabilizes the lives both of the patients as well as the workers. I'm a big believer in this. I'm certainly going to fight to make sure that we get it done.
Thank you, Senator. Assemblymember Paulin, any final thoughts?
Yes, thank you so much. First, thank you again, as everyone has said, for organizing and for continuing to be a body that brings us all together to champion this issue, because we know how important it is. Alongside my colleague and friend, Senator Rivera, I also will be championing this issue in the Assembly. There's no question that it's important to have our families have this option, and we risk not having this option if we don't invest. Too many times, we take an action in the legislature and think we've solved the problem. So last year we took an action and somehow that's supposed to solve the problem. And unless we ensure that we follow the action we've taken and look to see what it's accomplished and not accomplished, we have a risk. And I think that's where we're at right now. We don't know whether we didn't get everything we wanted last year. So getting a small piece, is it going to lead to solving the problem? I think those of us on this webinar don't think that's the case. So we need to continue to keep this issue in the forefront. We didn't solve the problem. We can't be complacent.
Great. Thank you, Assemblymember. Briefly, Audria and then Alana.
Yes, thank you. I would say to the execs, stop saying that you believe that home care and home care workers are important and then doing something that demonstrates something very differently. So pulling home care workers out of the healthcare worker bonus demonstrates you're not thoughtful about the home care workforce. Reversing the gains that we made in last year's budget this year shows you're not really invested in home care. So stop saying one thing and doing something else.
Great, thank you. And Alana?
I mean, in a time where there's sometimes some complicated political questions, the governor has a really easy one in this. You can enact the full language of fair pay for home care. You can end the worker shortage. You can invest in our economies. You can allow everyone who wants to age in their own home to stay there. And you can do something that is widely popular across the state.
And David, just 10,
Yeah,
15
real
seconds.
brief. It's March is Women's History Month. We heard earlier 90% of the workforce is women. Frankly, women live longer than men, so they're also the majority of people who need the care. The family caregiver is most likely a female. There are male caregivers. I was one. And those women that are now unpaid family caregivers are sacrificing their own economic security and their retirement by taking the time off from their own job to try to keep their loved ones safe and at home. And the paid home care worker is critical to that effort. Thank you.
Great. Thank you to all of our panelists. Thanks to our sponsor, ARP New York. Thanks to everyone who turned in today. And that concludes our program.
Thank